day 70 of our 365 days project, and we are going to see about management of acne. Many different treatments exist for acne. These include alpha hydroxy acid, anti-androgens medication, antibiotics, anti-seborrheic medications, azelaic acids, benzoyl peroxidase, hormonal treatments, keratolytic soaps, nicotinamide, retinoids, and salicylic acid. Acne treatment works in at least 4 different ways, including the following: reducing inflammation, hormonal manipulation, killing C. acnes, and normalizing skin cells shedding and sebum production in the pore to prevent blockage. Typical treatments include topical therapies such as antibiotics, benzoyl peroxidase, and retinoids, and systemic therapies including antibiotics, hormonal agents, and oral retinoids. Skincare. In general, it is recommended that people with acne do not wash affected skin more than twice daily. The application of a fragrance-free moisture to sensitive and acne-prone skin may reduce irritation. Skin irritation from acne medications typically peaks at the 2 weeks onset after use and tends to improve with continuous use. Dermatologists recommend using cosmetic products that are specifically say non-comedogenic, oil-free, and won't clog pores. Diet. Dermatologists also recommend a diet low in simple sugars as a method of improving acne. Medications. Benzoyl peroxidase. The common acne vulgaris treatment, benzoyl peroxidase cream. Combination products use benzoyl peroxidase with a topical antibiotic or retinoid such as benzoyl peroxidase or clindamycin, benzoyl peroxidase with adapalene, respective, which are found to be effective. Side effects include increased skin photosensitivity, dryness, redness, and occasional peeling. Sunscreen use is often advised during treatment to prevent sunburn. Lower concentration of benzoyl peroxidase are just as effective as higher concentration in treatment again, but are associated with few side effects. Unlike antibiotics, benzoyl peroxidase does not appear to generate bacterial antibiotic resistance. Retinoids. Retinoids are medications that reduce inflammation, normalize the follicle cell life, and reduce sebum production. They are structurally related to vitamin A. The retinoids appear to influence the cell life cycle in the follicular lining. This helps prevent the accumulation of skin cells within the hair follicle that can create a blockage. There are first-line acne treatment, especially for people with dark colored skins. Retinoids are known to lead to faster improvement to post-inflammatory hyperpigmentation. Topical retinoids includes adapalene, retinoid, tartolin, trifartin, tinorin. They often cause an initial flare-up of acne and facial flushing and can cause significant skin irritation. Generally speaking, retinoids increase the skin sensitivity to sunlight and are therefore recommended for use at night. Antibiotics. People may apply antibiotics to the skin or take them orally to treat acne. Widespread broad-spectrum antibiotic overuse for acne has led to higher rates of antibiotic resistance. C. Acne strains worldwide, especially to the common used tetracycline and macrolide antibiotics. Commonly used antibiotics either applied to the skin or taken orally include clindamycin, erythromycin, nitrodiazid, sulfactamide, and tetracyclines. Oral antibiotics are recommended for no longer than 3 months as antibiotic course. Exceeding this duration are associated with the development of antibiotic resistance and show no clear benefit over shorter durations. If long-term oral antibiotics beyond 3 months are used, then it's recommended that benzoyl peroxidase or a retinoid to be used at the same time to limit the risk of C. acnes, developing antibiotic resistance. Topical Dapsone is sometimes a preferred therapy in women and for people to sensitize dark toned skins. Hormonal agents. In women, the use of combined birth control pills can improve acne. The medications contain an estrogen and a progesterone. They work by decreasing the production of androgen hormones by the ovaries and by decreasing the free and hence biologically active fractions of androgen, resulting in lower skin production of sebum and consequently reduced acne severity. Pregnant and lactating women should not receive anti-androgens for their acne due to the association with birth disorder such as hypothyroidism and feminization of male babies. Azelaic acid. Azelaic acid is effective for mild to moderate acne when applied topically at 20% concentration. Treatment twice daily for 6 months is necessary and is effective as topical benzoyl peroxidase 5%, erythropoietin 0.5%, and erythromycin 20 per T. It has slightly skin-lightened effect due to the availability to inhibit melanin synthesis. Therefore, it is usually in treating individuals with acne who are also affected by post-inflammatory hyperpigmentation. Salicylic acid. Salicylic acid is a topical applied beta-hydroxy acid that stops bacteria from reproducing and has keratolytic properties. It is less effective than retinoid therapy. Salicylic acid opens obstructed skin pores and promotes the shedding of epithelial skin cells. Dry skin is most commonly sight-seeing effect with topical application through darkening of skin can occur in individuals with darker skin types. Other medication. Medication like nicotinamide, hydrochloroquine, combination therapy using medications of different class together, each with a different mechanism of action, has been demonstrated to be a more effective approach to acne treatment than monotherapy. Procedures. Limited evidence supports comedo extraction, but it's an option for comedones that do not improve this with standard treatment. Another procedure for immediate relief is the injection of a corticosteroid into an inflamed acne comedone. Electrocautery and electrofugation are effective alternative treatments for comedones. Light therapy with regular light and laser has also been used. Dermabrasion is an effective therapeutic procedure for reducing the appearance of superficial atrophic scars of box scar and rolling varieties. Dermal and subcutaneous fillers are substances injected into the skin to improve the appearance of acne scars. Fillers are used to increase natural collagen production in the skin and to increase skin volume and decrease the depth of the acne scar. Microneedling is a procedure in which an instrument with multiple rows of tiny needles is rolled over the skin to elicit a wound healing response and stimulate collagen production to reduce the appearance of atrophic acne scars in people with darker skin color. Subcision is useful for treatment of superficial atrophic acne scars and involved the use of a small needle to loosen and fibrolytic adhesions that results in the depressed appearance of the scar. Chemical peels can be used to reduce appearance of acne scars. Alternative medications. Researchers also are investigating complementary therapies as treatment of people with acne like tea tree oil, basil oil, etc. Prognosis. Acne usually improves around the age of 20 but may persist into adulthood. Permanent physical scarring may occur. There is good evidence to support the idea that acne and associated scarring negatively affects a person's physiological state, worsen mood, lower self-esteem, and are associated with a high risk of anxiety disorders, depression, and suicidal thoughts. Another physiological complication of acne vulgaris is acne exorcia, which occurs when a person persistently picks and scratches pimples irrespective of the severity of the acne. This can lead to significant scarring, changes in the affected person's skin pigmentation, and a cyclic worsening of the affected person's anxiety about their appearance. Rare complications from acne or treatment include the formation of pyogenic granulomas, osteoma cutis, and acne with facial edema. Early and aggressive treatment of acne is advocated by some in the medical community to reduce the chances of these poor outcomes. Thank you.